Some stakeholders have emphasized the need to prioritize marginalized women and girls to end gender-based violence as well as other harmful traditional practices in the country. They made the call at an event to end gender-based violence in Abuja, tagged Flashlight Action on Girls' Safety Flags 16 Days of Activism 2021. Mrs. Adetayo Erinle, Executive Director, Tabitha Kumi Foundation, said the high record of cases of gender-based violence necessitated the need for all stakeholders to collaborate to end the scourge and ensure that offenders are prosecuted.
We'll be working to advocate for inclusive, comprehensive and long-term strategies, programs and resources to prevent and eliminate all forms of violence against women and girls in public and private spaces, prioritizing the most marginalized women and girls. Amplify the success stories demonstrating that violence against women and girls is preventable by showcasing effective strategies and interventions to inspire all actions to scale up what works. Create awareness to health workers and public on the gender-based violence referral pathways. Engage stakeholders to take do no harm pledges and make commitments towards reporting cases of gender-based violence. Flags will create safe spaces in the community for learning, facilitated by amitaches. Amitaches are teachers' friends, and survivors will be linked to gender-based violence protection, prevention, and response through a case management hub, and it will be coordinated by those we call Mama Yaras. They are health officers in the communities, in the primary healthcare centers in the communities, working together with the police and with FIDA to achieve the project outcomes. We will also work with community leaders and all the different groups in the communities, men, women, boys and girls, to create robust awareness on gender-based violence and provide support for the prevention and response, as well as to create an enabling environment for marginalized girls to thrive.
Mrs. Mariam Shwaibu, Assistant Director, Federal Ministry of Women Affairs, stressed the need for all stakeholders to join government to end gender-based violence.
I want to encourage all stakeholders to really go down. Mothers are having this feeling that if their children are violated, it's like it brings embarrassment, it brings shame. So it's even the parents that are covering whatever violences children are going through. We need a lot of work to do with parents and even children themselves, how to prevent themselves. We do this in school, we do this in communities, and that is why I am happy with Tabitha Kumi. The Ministry of Women Affairs will continue to work with Tabitha Kumi to ensure that all her intervention programs succeed very well to the betterment of Nigerian girls and women.
In her remarks, Mrs. Fumi Kolawole, Gender Desk Officer of the FCT Police Command, said the 16 days of activism to end gender-based violence was a clarion call to all stakeholders to join in the fight to ensure all cases are not withdrawn but pursued to the latter.
The long duration of this program shows how important the fight against this pandemic of sexual gender offense is in the heart of everyone across the globe. All hands must be on deck to put an end to violence against women and girls. And with our efforts together, we will kick off violence against persons and girls from Nigeria.
Similarly, Mrs. Binite Alero, a member of the board of Tabitha Kumi Foundation, said more advocacies on gender-based violence would aid the effort to end the practice and encourage people to speak out.
16 days to make others aware that we must shout out and speak out and put an end to gender violence. Wherever you are, whatever you do, there's always that little bit you can do to protect that young woman, that old woman, that middle-aged woman from the hands of those who seek to oppress her through gender violence.
For his part, Dr. Sunday Goji, Director, Primary Healthcare Center in Wari Area Council area of the FCT, commended the organization for its support and called on law enforcement agencies to be proactive in handling gender-based violence.
Because most of those times the victims do not have access to health facilities for prompt examination and treatment, because some of those evidences that will be needed to prosecute the offenders are not most of the time available. Even the male ones are also affected. We know there are abuse of young male children in the society that are being carried on. It goes on, but we don't know, because there is denial, especially at the community level, and when the children of big men or big men themselves are involved, those cases tend to be hidden.